Hello, and thank you for joining us. My name is Brittany, and I am here with Jessica, Salissa, and Svetlana to talk to you about needlestick injury and the steps you can take to protect yourself while handling needles. Needlestick injury is a wound caused by needles that accidentally puncture the skin. They can occur at any time when people use, disassemble, or dispose of needles. Devices that can be involved in needlestick injuries include disposable syringes, suture needles, winged steel needles, intravenous catheter stylets, and phlebotomy needles. Needleless MedPrep needles are needleless plastic cannulas designed to access rubber stopper med vials. This prevents doling of hypodermic needles and decreases the chance of needlestick injury during MedPrep.
This is a passive needle device, which is found to be the most successful type in reducing needlestick injuries.
The following videos are going to show you how to safely handle both needleless needles and hypodermic needles.
This is how to apply a needleless needle. Hold the syringe in your dominant hand and turn the tip, locking the needle onto the syringe. This is the proper way to recap an open needle. Place the cap on a flat surface with the back against something and scoop with the needle, then firmly pushing it into place. Or use a recapping device as shown here. This device holds the cap into place, minimizing the chance for a needlestick injury.
This is the proper way to switch from a needleless needle to a hypodermic needle. Don't forget to dispose the used needles into the sharps container. This is how you engage the safety mechanism for used needles. Use the hand with the syringe to activate safety mechanism. Be sure to keep your other hand away from the needle.
If a needlestick injury ever happens to you, you should perform the following steps to ensure your safety. First, wash your hands. Second, notify a supervisor or your instructor. And third, immediately seek medical attention.
Bloodborne infectious diseases that can be transmitted via needlestick are HIV, hepatitis B, and hepatitis C. Risk of transmission from a single percutaneous needlestick or cut with scalpel from an HIV-infected individual is about 3 out of every 1,000 healthcare workers. Post-exposure prophylaxis or an antiretroviral medication should begin as soon as possible after exposure to HIV, but certainly within 72 hours. The most common organism acquired by needlestick injury is hepatitis B. Hepatitis B virus immunoglobulin can prevent a full-blown infection for those not vaccinated. Only about 2 to 5% of people will go on to develop chronic infection. Over a lifetime, there is 15% risk that individuals will develop liver cancer or cirrhosis. After needlestick injury, people are also at risk for hepatitis C. The exact number of workers that have developed hepatitis C after needlestick remains unknown because of lack of follow-up. With hepatitis C, more than 75% of adults will develop chronic infection. About 3/4 will develop acute liver disease, and of that 20% will go on to develop end-stage liver disease or cirrhosis.
In the U.S. alone, nearly 600,000 needlestick injuries go unreported. This value is greatly increased in developing countries due to lack of knowledge related to needlestick injury. We hope you've enjoyed our video and can use some of the information we have provided in your future nursing careers. Thanks for watching!